Thank you for joining my presentation on medical assisting. My name is Julie Rasmussen. I'm a certified medical assistant with over 30 years of clinical experience in family practice, neurosurgery, triage, and cardiology. I have an associate degree in medical assisting and a bachelor's degree in occupational education. I've been with Rasmussen University for 13 years as a medical assistant instructor and medical assisting program coordinator. What is a medical assistant? We are an important and respected part of the healthcare team. We work alongside doctors, nurse practitioners, and physician's assistants to provide patient care. We are multi-skilled professionals that are cross-trained to work in many areas of the clinic. We perform administrative and clinical duties. What is a day in the life of a medical assistant like? We obtain vital signs, but we do so much more than that. When a patient arrives, we greet them and bring them back to the exam room. We start by reviewing their medication lists and refill with the provider's authorization. We then update the patient's medical, surgical, family, and social history. We review their health maintenance and preventative care measures. We determine what screenings the patient is due for and schedule any needed testing and place orders for things such as colonoscopies, mammograms, diagnostic studies, specialty referrals, and if the patient is in need of immunizations or any blood work, we can complete that at that time. We gather the patient's chief complaint and symptoms and ask further questions to assist the provider with diagnosis and treatment of the patient. Whatever the provider needs during the patient visit and during the day, the MA is their go-to person. We perform venipunctures, remove sutures and staples, and change dressings. We perform basic laboratory tests such as strep, mono, urinalysis, pregnancy, influenza, glucose, cholesterol, hemoglobin, hematocrit, and COVID specimen collection and COVID testing. We perform injections such as antibiotics, pain medications, and steroids. We administer immunizations for childhood and adult vaccines. We perform EKG testing, complete vision and hearing screenings, perform ear irrigations, and one of my favorites, assist with minor office surgeries for things such as mole and cyst removals, toenail removals, OB/GYN procedures, and urology procedures. We're always learning something new. Providers now rely on the medical assistant to go into the exam room with them during the patient visit. The MA acts as a scribe. The provider focuses solely on the patient, while the MA is entering information into the electronic health record. The MA places orders for labs, x-rays, referrals, and appointments. The MA sends medications and refills to the pharmacy. The administrative duties that we perform are minor billing and coding for insurance claims. We arrange hospital admissions and laboratory services, complete referrals to specialists, and schedule appointments for outpatient procedures and follow-ups. Our skills classes are hands-on. Here we are practicing injections, practicing venipunctures. We even have Pediatric Day. This allows our students to practice non-invasive procedures such as vital signs, vision, and hearing screenings. Some fun facts about medical assisting. Medical assisting is a career. It can be also used as a stepping stone to other medical careers such as nursing. Doctors rely on the information provided by the MA to help diagnose and treat the patient. The work that the MA does is crucial to help the doctor to complete their daily work. About 23% of medical assistant grads continued on for their additional education at Rasmussen University. MA is a very stable career, one of the leading healthcare careers in demand. MAs have different and varied roles within the clinic, and those roles are constantly changing according to the needs of the provider and the clinic. MAs have more responsibility than ever before. Continued training and education as the MA role evolves. Areas where medical assistants work. MAs are able to work in a variety of areas, clinical settings, and specialty clinics. Outpatient clinics, family practice, pediatrics, obstetrics, orthopedics, dermatology, surgery centers, COVID clinics, phlebotomists, blood centers, dialysis centers, urgent care facilities, nursing homes and extended care facilities, and insurance companies. Employers are desperately seeking medical assistants, especially in the larger communities. Many companies are offering a sign-on bonus and have tuition reimbursement for continuing education. It is incredible job security. The salary starts around $35,800, depending on the clinic, specialty, and any experience that you may have. Now is a great time to be a medical assistant. Medical assisting is one of the nation's fastest growing careers, much faster than the average for all occupations. Employment of medical assistants is projected to grow 18% from 2020 to 2030, which is much faster than the average for all occupations. About 104,000 openings for medical assistants are projected each year on average over the next decade. That's incredible growth and a very stable career. The MA work schedule. It's common belief that anything in the medical profession requires irregular and long hours. For medical assisting, that's not true. Medical assistants typically work Mondays through Fridays, 8 to 5. Typically, we do not work nights or weekends. If we do, it's very rare where we're rotating among our department. No holidays and no forced overtime. The medical assisting diploma at Rasmussen University can be completed in about 12 to 15 months. The education includes structure and function, medical terminology, medical law and ethics, your clinical skills classes, virtual simulation labs, experience with electronic health records, basic life support CPR and first aid certification, blood pressure cuffs, stethoscope kits, books and fees, externship at a clinical rotation which provides real-world experience prior to graduation, and your first attempt at a credentialing exam post-graduation with either the CMA or RMA is included. The classes are blended, which is residential and online, and your procedures or skills classes are held on campus 1 day per week. There is no waiting list for any of the programs at Rasmussen University, the Green Bay campus, especially medical assisting. For medical assisting, we start 8 times per year. We have smaller class sizes, which provide more one-on-one help, our hands-on skills learning, again, that blended education. Rasmussen University does have financial aid, Change a Life scholarship, and we have corporate alliance grants. We have several other programs at Rasmussen University in the School of Nursing, School of Health Sciences, and many other programs available within the schools of Education, Technology and Design, Justice Studies, and the School of Business. We have associate and bachelor degrees, and we also have master's degrees. What's next? Let us know how we can help be a part of your educational journey. Contact Tony Posley, Director of Admissions, at 920-593-8459 or tony.posley@rasmussen.edu. Thank you, and I look forward to meeting you.